Well, pineapple, arugula, potatoes. These are all normal, fairly healthy foods, unless they're causing your body to revolt. Today I'm sitting down with Dr. Fit for Life, Dr. Armand Shayesta, to learn why we should know exactly which foods we personally cannot tolerate. And I picked that list, doctor, because those are foods that you found out you're intolerant to.
Absolutely, and that's what's important, Robin. There's a difference between food allergies and food intolerance. Food allergy engages the immune system, and the symptoms are instant. So somebody allergic to peanut butter, they put peanut butter in their mouth, they're on the floor, they can breathe. But food intolerance symptom takes half an hour, 3 hours, or whole day.
Got it.
Because food intolerance connected to body's inability to digest the food. When you're not properly digesting food, this causes a condition is called leaky gut syndrome. I know I always mention that sounds kind of really bad.
It sounds so awful, yes.
But the reality, leaky gut syndrome is nothing but inflammation and changing the permeability. If you look at the lining of the intestine, on the left side, those cells are tight junction, very healthy. But when you have a food intolerance because of inflammation, you can see those opening. That permeability changes. Now the rub and all this stuff, toxin, microorganism, gluten, everything leaks directly to the blood circulation. 73% of our immune cells are in our guts. So when all these chemicals are coming in, cause a severe inflammatory response, and this really affects entire your body. Look what the leaky gut syndrome does. Causes gastrointestinal issues, people with IBS, inflammatory bowel disease, cause inflammation, joint pain, skin rashes, actually sinus issues. Some of the research shows affects actually Hashimoto disease that affects the thyroid function. And also, some of the inflammation affects also brain function. This is really interesting. On top of those organs, some of the symptoms, stomach pain, irritability, all those things. But this is really interesting. Food intolerance, now research shows that affects the production of serotonin. Serotonin is a major brain neurochemistry that, Robin, controls our mood, happiness, food metabolism, our energy level. Now research shows over 90% of serotonin actually made in our guts. So when you have a food intolerance, and there's a significant drop in production of a serotonin. Serotonin is appetite suppressant. Tells me I ate my lunch, I release serotonin, I'm a happy guy, stop eating. But when the serotonin is not produced, there is no signal like that. So I have a significant craving for sugar and carbohydrate to make those happy hormones using more food. That's why that food intolerance actually causes a significant amount of weight gain. Also, food intolerance not only affects the serotonin, but affects other brain neurochemistry, such as dopamine, epinephrine, oxytocin. So people with food intolerance experience anxiety, depression, chronic fatigue, brain fog. These are all the symptoms of a food intolerance, different stages of that. This is really interesting. When you have a food intolerance, there are two kinds of bacteria in your guts, good and bad bacteria. We want more of a good bacteria. Bad bacteria, Robin, basically grows on fat and sugar. So when you have a food intolerance, there's a large population growing. That's why they actually release a chemical, tell our brain, go eat more fast food and more cookie, because that's the food they actually grow on it. Literally, our gut takes over our brain. So that's why by not correcting that, not only cause all clinical issues, but also affects what we are eating. The question is, what I'm going to do?
Right.
This is a very common question because people make a mistake between food intolerance and food allergies. As I mentioned, food intolerance is a totally different story. Now, fortunately, we have a very advanced technology, uses microarray scanning technology, that actually we can measure your antibody IgG against the protein of over 200 foods. Literally, this is so specific that will end up actually telling us, for example, in my case, said pineapple, arugula, potato. Doesn't say, for example, watch nuts or seeds. It will very specifically name the food, so we can just get in and remove that. And some research that actually within a few weeks, there's a significant change on the symptom because of the inflammation goes down, body starts repairing itself, and also by eliminating food intolerance, you can increase the population of good bacteria, which is critical for our health. We want to give them an opportunity to grow. So that's why by changing your nutrition, understanding what your food intolerance you have, you can actually significantly improve your health, weight loss, chronic fatigue, all the depression, anxiety, inflammatory disease, acid refluxes. These are the consequences of that. The reality now research shows that actually, Robin, our gut is the gate for our body. So anything having our guts is going to have entire our body is affected that.
And that is why you are so good at customizing these diet and nutrition plans for people, because it is a specific thing. So go and get the testing, food intolerance testing, done at the Fit for Life Nutrition and Weight Loss Clinic there in Dublin. So, Doctor, thank you so much.
Thank you for having me there.